Hello there, I'm Neil-Pakenham Walsh. I'm the coordinator of HIFA2015, Healthcare Information for All by 2015. I am based outside of Oxford in the UK, and just to say a little bit about my background, I'm around 50 years old right now, and 27 years ago I qualified as a doctor in London at St George's Hospital. I worked as a hospital doctor for a few years. I had some experience as a rural clinical officer out in Peru and Ecuador in the late 1980s, and became interested in the access to health information for health workers in developing countries. I've got a background that's in medical publishing and practical hospital medicine. But what I was interested in was particularly I recognised that the needs of health professionals appeared not to be properly met in general, and that the people who, like myself, who were writing and editing content for health workers, we didn't have a clear idea of what the information needs really were, and also I sensed that there was a lack of communication between the various groups, the publishers, the librarians, and the health professionals about understanding these needs and what could be done to meet those needs. So that there's a complex community out there who are trying to address the information needs of health workers, but the community has been quite fragmented. So much of my work has been about aiming to stimulate better communication between the various actors who are working in the health information field. The HIFA 2015 project was launched in 2006. It's a campaign, and it's also a learning network or a knowledge network, and its main feature is the HIFA 2015 email forum. And the aim is to bring all the stakeholders together around a shared goal that we elaborated or defined during the early days of the forum. And that goal is healthcare information for all by 2015, which we phrased as being by 2015, every person worldwide will have access to an informed healthcare provider. The campaign works around a strategy of 3 pillars. The first pillar is to promote communication, as in the HIFA 2015 forum. The second pillar is to promote better understanding of the information needs of health workers and how we can meet those needs, and that's through the HIFA 2015 knowledge base. And then the third pillar is our advocacy program. We have a strategy whereby those are all integrated to promote political and financial commitments from funding agencies and governments to support health information activities around the world, and thereby ensure that by 2015 people will no longer be dying for lack of knowledge. Well, first of all, our work is founded in human rights, and particularly the rights to healthcare. And we hope that our work will both raise awareness among the general public in developing countries and health professionals about the right of access to safe, informed healthcare. And we've been working with the New York Law School on a paper that looks at access to information under international law, human rights law, for example. So it's promoting awareness about that, and also by promoting awareness about access to health information and the right of access to information and to safe healthcare. This has the potential to raise the accountability of governments and healthcare providers, by which I mean particularly with governments. They can and should be held accountable to ensure that all citizens and healthcare providers should have access to the information that they need to for safe behaviour and safe practice. And similarly, healthcare providers need to be more accountable for the quality of their healthcare. And if the general public in developing countries, as is more and more the case in developed countries, if the general public are more aware of the importance that healthcare providers are up to date and that they have access to good information and knowledge, they will be the healthcare providers will be more and more accountable to the general public, and the general public will be more critical of the quality of healthcare and will not just take whatever is given to them necessarily. They will get a better understanding that sometimes healthcare can be harmful, and particularly if the healthcare is uninformed. The whole issue of health systems strengthening is critically important. The human resources in health systems are the most important part of any health system, and HIFA 2015 is all about understanding and addressing the information needs for those human resources for health, ranging from doctors through to community health workers, and indeed our remit includes health information for families and individuals also. We see that information is, if you like, the lifeblood of the work of health workers. Without clinical knowledge or with distorted clinical knowledge, health workers are not empowered to deliver health care, and they are indeed at risk of providing either unsafe or at best ineffective care. Now clearly health workers have a whole range of needs other than information. We look at that as in using the acronym SEISMIC, SEISMIC. So we can look at the 7 needs of healthcare providers as being skills, equipment, information, structural support, medicines, incentives, and communication facilities. Now, if any health worker does not have adequate amounts of all of those 7 ingredients, if you like, then they will not be empowered to deliver safe and effective healthcare. And we are aligned with the vision of the Global Health Workforce Alliance, which is based at the World Health Organization and which is working towards a future world where every person has access to a health worker who is skilled, motivated, and properly supported. Because it's only by focusing on the needs of healthcare providers and enabling them, empowering them to deliver safe and effective healthcare that we're going to see real improvements in mortality and morbidity statistics and reaching the MDGs. So effectively, we are part of a much bigger community of people around the world who are working to empower health workers to deliver better care.